My name is Akwasi Boah. I am a neurosurgeon with the Texas Back Institute. Steve Kerr and Thad Matta are just the latest examples or unfortunate things that can happen with coaching. And so, coaching, like many other professions, requires you to be on your feet and stand for hours and hours and hours. And what you do a lot in coaching is very quick pivoting, rotation, things like that. When you're talking, yelling at the refs, trying to get your team to do things, you're on your feet for hours, longer hours than you were ever intended to be standing on your feet, loading weight on the disc in your lumbar spines. Steve Kerr had a nagging lumbar disc herniation, which eventually required an operation twice in 2015. The deal with him was that his first operation was complicated with a spinal fluid leak, by a spinal fluid leak, and that's not really that common, but it happens enough for us to have the literature to report about that, and those are easily researchable numbers. That number is usually about 1 to 3% for someone who's never had surgery before, and so sometimes you can have incidental or accidental tears in the dura, and you can have a leakage of spinal fluid, which is meant to be the cushioning, the shock absorber for your central nervous system, for your brain, spinal cord, and then all the nerve roots that descend from the spinal cord. The standard course of care post-operatively is that you are kept flat if the leak is in the lumbar or lower thoracic region. And the reason for that is to allow for healing after a primary closure. That's one of the most important things to find out if someone has any kind of lumbar operation and there is a reported leak. The first thing to find out is if they were able to fix it. Kind of gives you an idea about what to expect going forward. So from what I gather, Thad Matta's situation is different in that he's already had an operation, which was actually years and years ago. However, he's had further symptoms come to light as of recent, which were unfortunately so bad that he could not coach anymore. It's very important to know and educate yourself as much as possible about what to expect going in so that you know what to expect going out. The bad things that happen typically aren't planned for because nobody's expecting them to happen. You kind of want to know how familiar your surgeon is with the operation that he or she is recommending that you have done. Have you exhausted all of the conservative measures? Were there any technical problems or issues with the case after it was done? And do you have as much information as you can possibly have about a reasonable improvement clinically before going forward? All surgeons come out with many different skills, and in time most of us will gravitate toward a specific group of operations that we do typically, and that's what you really want to get a sense of from your surgeon. Now that's typically listed online or by the practice, but you can also ask. I really believe in establishing a good rapport with your surgeon so they can honestly tell you what to expect. And it's most important that if you are with someone who is not comfortable doing an operation, that they just simply get you to the person that they would recommend to have that operation. And that is all about outcomes. The main concern is the improvement of your health. The information that I'm speaking about today is essentially what I've gathered from the media, television and online resources. I am not treating either of these individuals clinically, nor am I involved in any of their medical consultant work.